Hi, I'm Casey Durkin, and I am the Director of Children and Family Programs here at the Gathering Place. I also lead our young adults group, which is designed to help folks between the ages of 18 and 40. We welcome you to our very first live event on Facebook, Facebook Live, and this is specializing on colorectal cancer in young adults. So some of the things that our young adult group does is that we focus on hot topics such as careers, relationships, fertility, financial issues, legal issues, and more. But we'll be talking more about that later. I'm curious, how many of you watching are familiar with the Gathering Place? Please let us know in the comments section. The Gathering Place is a community cancer support center here in Northeast Ohio, so we're local. And what's really important is that we are, one of our mission statements is really to provide free programs to anyone touched by cancer. We were established a little over 20 years ago, and that's when we opened our doors. And since then, we've served over 47,000 people. So it's really great that people can find us, but we're going to talk a little bit about colon and rectal cancer in young adults. So truth be told, the numbers with colorectal cancer are down. However, the numbers of young people being diagnosed with colorectal cancer are on the upswing. And what we know is that 10% of all of those newly diagnosed people with colon and rectal cancer are under the age of 50. So we're going to talk a lot about this. We're very fortunate today to have a Cleveland Clinic oncologist from the Taussig Cancer Center, Dr. Mark Kyei. Following Dr. Kyei's presentation, you're going to hear from Vincent, one of our participants at the Gathering Place, who's a young adult with his personal cancer journey and how he found cancer, colon rectal cancer, at the age of 30. We'll have some Q&A time, and we will also be joined today by Aqeel, Program Manager at Taussig Cancer Center. Aqeel and I will talk about resources that are available in Cleveland today, and we will be opening this up to your questions. Feel free, though, to please place questions and any commentary in the comment section so that we can make sure that we get those to Dr. Kyei. Let's see. Oh, before I turn this over, though, why don't you share with your family and friends that you're watching this live so that we can get more people educated and to learn more about this. We've got many services at the Gathering Place. So if you're struggling with other issues like grief, please know that you can reach out on our through our website and our phone number, which will be streaming across the bottom at some point, to get help with other issues related to cancer. So thank you very much. Thank you, Dr. Kyei.
Thank you. Thank you. And hi, everyone. I'm Dr. Kyei, Mark Kyei, and I'm one of the oncologists here at the Cleveland Clinic. And as you already heard, my topic is on colon cancer in young folks, young population. And basically, as we all know, the rate of colon cancer in general is decreasing over the past couple of decades, but the rates are increasing in younger folks. And what I mean by young folks, meaning that those who are less than age 50. And this awareness in this group has come about with the recent death of Chadwick Boseman from colon cancer at the age of 43. I mean, we already knew about this rate, but it's now become a little bit as a buzz topic or something that people talk about lately. And in 2020, about 18,000 cases of colorectal cancer will be diagnosed in people younger than 50 years old. And that's about 12% of colon cancers that are being diagnosed in the year of 2020. The rate keeps rising in this young group, about 2% per year, compared to the falling rates in older folks, that is older than age 50, which is dropping about 3.6%. Actually, over the past 20 years, the rate of colorectal cancer has dropped. And it keeps rising in younger folks. Basically, the younger you are, the more younger you are, the higher the rate, because the highest rate in colorectal cancer is between age 18 and 35. So this is the group that the rates are rising, and yet we don't have any screening or recommendations within this group. Colorectal cancer is the second most common cancer death, cause of death related to cancer. It's only second to lung cancer. There is a racial and ethnic disparity in the rates as well. We know that colorectal cancer cases and deaths vary among racial and ethnic groups. The reason is multifactorial and complex. We know that risk factors like smoking, excess weight contribute to colorectal cancer, but healthcare access and colon cancer screening both are related to socioeconomic status and other factors. The lack of healthcare access and screening for colorectal cancer, basically, especially in the young folks, play such an important role in the rates of colorectal cancer. Asian and Pacific Americans have the highest rate. Actually, they have the lowest rate in non-white population with colorectal cancer. They have about 39 per 100,000 folks, while Blacks have about 46 persons per 100,000 cases. The Native Americans and Alaskan natives basically have the highest rate of colorectal cancer incidence. They have about 89 per 100,000. And the deaths is about the same. It follows the same pattern, but it's twice as much in terms of percentage. For instance, if we take the Black folks or population, 40% increased risk of death from colorectal cancer. That's how much your risk of dying from colorectal cancer if you're a Black folk. And you have about 20% increased risk of incidence, having colon cancer. Now, when we look at the screening tests and the screening rates, we know that in 2018, about 66% of those who are older than age 50 get screened for colorectal cancer. They get their colonoscopy or any other test that is available. However, the rate of screening in those who are younger than 50 is about half or even less than half that of those who are older than 50. So we realize there is a need. We know that this group is at risk. They have the highest or increasing. I reframe my statement. It's not the highest, but it's increasing rates in colorectal cancer incidence, and yet they don't get to be screened for colorectal cancer. In United States, those who are uninsured only have about 30% screening rate. Those who are on Medicaid, 53%. Asian Americans, 55%. And those who have lived in United States less than 10 years have 26% screening rate among them. So acknowledging this rising rate of incidence in colorectal cancer in young folks, as well as the low screening rates, the American Cancer Society basically now recommends screening for colorectal cancer starting at the age of 45. However, this is not a general consensus. I mean, because it's not an generally accepted guideline. The American Society of Clinical Oncology and the US Task Force recommend age 50 to be screened for those who have what we call standard risk. And what I mean by standard risk for colon cancer is that you don't have any family history of colon cancer, you've not had any personal history of colon cancer or bowel disorder like inflammatory bowel disease, Crohn's disease, ulcerative colitis, no history of polyps, those kind of things. You are recommended to start being screened for colorectal cancer at the age of 50. But if you have any of these following risk factors, like a family history of colorectal cancer or certain polyps, a personal history of colon cancer or polyps, a known or suspected family history of any genetic cancer syndrome. You know, there are some folks who cancer run through the family. An example is what we call Lynch syndrome or FAP, familial adenomatous polyposis. Here they have certain genetic inherited genes that run through the family, and they develop polyps all the time, and this is bound to transform into colon cancer. If you've had a history of abdominal radiation, I mean, they've radiated your abdomen or your pelvis for other types of cancers, your risk also increases. So these are individuals who are considered high risk. Those individuals have to be screened for colorectal cancer at a younger age, that is younger than age 50. There are different types of screening tests available, so you have to talk to your doctor about it. Some of the screening tests include colonoscopy, which is usually considered the gold standard, but there are other tests like sigmoidoscopy, which looks at the part of the colon, not the entire colon, and is done more frequently. About every 3 to 5 years, you got to get a sigmoidoscopy done, as opposed to colonoscopy. Depending on what we see and your risk, it could range between 5 to 10 years. We also have stool tests that can be done, and the stool test consists of what we call FIT test, fecal immunotest, to look for any occult blood in the stool. That may be a sign of bleeding from the colon, and maybe a sign of cancer or a polyp. We also have the Cologuard, which look at the whole stool for DNA, and that may look for colon cancer DNA. It makes a diagnosis for a colon cancer. It may miss a polyp, and so these are the other tests that are available. You can talk to your primary or your doctor regarding what are the various tests that are there. You can also get a CT colonography, which is a CT scan which looks in the colon and constructs the colon, and may find a polyp also there. Now, these other tests that I've mentioned, if you have them done and they are positive or they are abnormal, you will have to get a colonoscopy, because that is the goal. We need to go in, look at it, exactly what is there, and biopsy whatever lesion is there. If it's a polyp or if it's a cancer, that can be removed. Now, why do we need to do screening at all in the first place? You know, screening for colon cancer is important because colon cancer takes time to develop. When you have a polyp, let's say you have an abnormal polyp or lesion in the colon, it takes decades, about 10 years, or even, definitely years, for it to transform from a benign polyp or adenomatous polyp, a precancerous polyp, to a colon cancer. And so if you get screened, we find these polyps sooner before they turn into cancer, and then we remove them. And that's how you prevent the cancer from happening. So colon cancers, the screening test can save life. It can help find and prevent colon cancer from happening. Now, since we all know that you cannot get screened before you are age 45, if you are younger than age 45, what do you have to know? Because you have to know certain symptoms of colon cancer, because you may not fall within that category of being screened. So I'm going to briefly talk about signs and symptoms that you need to look out for that may suspect that, hey, this could be a sign of colorectal cancer or something wrong with your bowel. Number one, if you have a change in bowel habits, you need to talk to your primary doctor and look into it. Diarrhea, constipation, narrowing of your stools, like a pencil shape, blood in your stools, so bleeding in your from rectal bleeding or mixed with the stools, you need to look into it. You need to talk to your doctor to get further investigation, further workup. Do not attribute it to hemorrhoids. We hear that all the time. Oh, I thought that it was from hemorrhoids. It may not necessarily be from hemorrhoids. If you have any abdominal pain or altered bowel habits, you have to look into that. If you have any dark stools or black stools, that may be a sign of bleeding. You should look into it. You should talk to your primary doctor for them to look into it. Even if you're taking iron pills, do not say that, oh, I thought it was the iron pills that changed my stools dark or black. Once it's black, we always have to rule out any abnormality in your bowel before we attribute it to something else. So I mentioned about abdominal pain or cramps. If you feel tired or weak, fatigue, that may be a sign too that you may be having colon cancer, because colon cancer bleeds and it's often associated with anemia, having low blood count. Unexplained weight loss, that's also another symptom. So, many of these symptoms may either come all by themselves alone or in combination, and they can be caused by other conditions. Other bowel disorders like the Crohn's disease and the inflammatory bowel disease that I mentioned, Crohn's disease or ulcerative colitis. These can also cause these symptoms, but they are also a risk factor for you to develop colon cancer. So if you have any of these symptoms that are there for a few days and they are still not getting any better, they are persistent, you need to check with your doctor and talk about it, and so that they look into it as soon as possible. At this juncture, I would like to stop here, and if anybody has any questions, I'll be happy to answer them.
Dr. Che, thank you so much. That was very informative, and we've got you for a little bit before we move into talking about resources available for people diagnosed and their family members and loved ones. And so if people have questions, please put them in the comments section, and we will be able to. So one question was, what can someone expect during their first appointment?
I
If they have concerns, and I'm going to guess that might be the colonoscopy. Maybe they're wondering what to expect during that.
So usually when we're talking about the colonoscopy, you will be, your doctor will have to order the test. And usually is either or two ways. You get an appointment with the doctor who's going to do the colonoscopy. And it could be a gastroenterologist, that's a GI doctor, or it could be a surgeon who may also do the endoscopy. But it could also be an order that will be put in place because it's a procedure. It will be put in place. You may not necessarily have to see the doctor as an appointment upfront before having the procedure done. However, you have to be prepared for the colonoscopy.
Mhm.
Why do you need to be prepared? You know, the colon itself, the colon is the large portion of the bowel, and its job is to absorb water and salt, but it also keeps the stool, the feces there. You cannot have your colonoscopy full of stool. Yeah, so we need to clean you up in order to see what's there. Yeah, and that's what we call the preparation. So you have to prepare yourself, drink a liquid which is more or less like a laxative. It's a laxative, it's Marilax. Yeah, and it will clear you out, empty the bowel, so that we can go in and look at it. And you may take it for about a day, 24 hours before the procedure. So the procedure is scheduled, it's an appointment, you get it done, it's an outpatient procedure that you get done, but it's done under like a twilight anesthesia. And after it's done, you recover from it. It may take maybe about an hour or two for you to recover from the procedure. I hope I answered the question.
And we have a couple follow-up questions related to that. So one is, like, how often would somebody experience needing that screening tool if just under normal circumstances? And then how often under abnormal, if, let's say, they find some polyps and remove those?
Yeah, so that's a very good question. So the standard risk individual who is going to get his first colonoscopy age 45 or 50, you get that one. If that colonoscopy, the whole colon is pristine, clean, there's nothing there, you get...
And by nothing, you mean no polyps?
No polyps, basically normal, no abnormality seen. So I'm talking about polyps, ulcers, nothing. I mean, basically it looks fine. Yeah. Or what's there is benign. You get your next colonoscopy in 10 years.
10 years. Okay.
Now, if we go in and we find something, you get a colonoscopy and we find something, depending on what we find. So if you have a polyp that is precancerous, you get a colonoscopy much sooner. That's 3 to 5 years.
3 to 5 years.
Yes, exactly. Depending on the type of polyp that we find.
Yeah. I just had a quick question, really quick, Dr. Che. For some younger individuals, the younger population in general, if they, suspect any of these symptoms, where is the first place they should start? Should they start with a, primary care doctor? Should they go to the ER? I mean, where should they actually start?
If you have a primary doctor, contact the primary doctor. Okay. If you don't have one, go to the ER. And that's what I'll say. If you can't reach your primary doctor, go to the ER. Yeah.
Okay. That's very important to know.
Yeah.
And I think what we also want to get across is, Dr. Che, if somebody does have a family history, they want to make sure that their doctor, their internist knows that entire family history, correct?
That's very important point that you've raised. Family history is very, very important. And you, as a young person, you should know your family history. You should know who in the family has had colon cancer or what type of cancer they've had, and whether there's any link or genetic link. Because there are certain cancers that are linked together. It may not necessarily be colon cancer, but they may have other cancers like endometrial cancer, ovarian cancer, breast cancer, gastric cancer, pancreatic cancer. That is also linked to colon cancer because Lynch syndrome, for instance. Yeah. And
thank you.
Other types of cancers in the family that may correlate, may put you at risk of colon cancer. Yeah. So you should know that. And then explore to see if there's a need for genetic counseling and testing. Yeah.
That's really helpful, Dr. Che. Thank you. So all of those cancers that you mentioned could be red flags to keep an eye out and make sure your doctor knows family history, and to keep an eye out for all of those little warning signs that you talked about.
Yes. Yeah.
Absolutely.
Great. Any other questions? Dr. Che has fit us in between patients, believe it or not. He's runs a full clinic, and but we want to make sure that your medical questions for Dr. Che do get heard, and you can continue to ask questions throughout the show. So that's all good.
And if there's more, I'm pretty sure we can get Dr. Che for a second session.
Absolutely.
Happy to come anytime. Yeah.
Thanks again, Dr. Che.
You're welcome. And thank you all for having me here and giving me the opportunity to come and talk to you.
Well, this is so valuable as we, really pay a lot of attention to Colorectal Cancer Month, which has been this entire month. So we do appreciate your time. And we're going to be hearing from a young man who was diagnosed at age 30 without any family history. So I guess, Dr. Che, you're welcome to stay on, but we'll bring Vincent on also at this point. Or I think, Aqeel, you were going to talk a little bit first before Vincent. Am I right with that?
I think we're going to hear from Vincent, but
okay, great.
If I could just say anything, obviously testimonies always sit very well with our viewers. And, we want to thank Vincent for sharing this experience. Just to, this is a relatable issue. Myself, Vincent included, and a lot of the other younger individuals who are tuning in, this is, as Dr. Che stated, something that's on the upward trend in younger adults under the age of 50. So, we're glad that Vincent can share his experience, but we hope ultimately that we all become more proactive in our health and not overlook some of those things that, can be much more than, what meets the eye. So again, thank you, Vincent. Thank you, Dr. Che. Obviously, we need to have more forums like this. So hopefully we can continue to do so.
Good. Thank you, Aqeel. And Vincent, so tell us a little bit about your cancer story and your journey from hearing a very frightening diagnosis to getting out on the other side of that diagnosis.
Yeah, I'll be happy to share my story. And I just want to make sure, can everyone hear me okay?
You can go a little louder if you can.
Okay. It's not coming, my audio is not coming through like choppy, is it?
No, it's clear.
Okay. All right. How's that? Is that a little bit better?
It's better. So the louder, the better.
Okay. All right. Sorry. I'll try my best here. Well, my name is Vincent, and I, kind of like Casey talked about, I was diagnosed with colon cancer at the age of 30. And I wanted to thank the Gathering Place and Cleveland Clinic for putting on this live discussion. Very helpful, very informative information, that was being provided. But kind of like Casey had mentioned earlier, I was diagnosed without any family history at the young age of 30 with colon cancer. And I didn't really have too many symptoms. Really, the main one that kind of prompted me to go into the emergency room and to really take action was just some severe abdominal pain that I was experiencing. And once I went into the emergency room, they were able to do a CAT scan on my abdominal region and found that I did have a blockage, and there was some stool backed up, and it was discovered that there was a tumor in my colon that was causing that blockage and that abdominal pain. And basically from that point forward, I was admitted to the hospital. I underwent a colonoscopy just to confirm that it was cancer related, and was within surgery after about 5 days of initially going into the ER. And after that, it was just a very like just like it was just I couldn't it was I couldn't believe what I was going through, because no one expects to be diagnosed at that young age, and especially with no family history, there was no really like, you know, need for me to like watch out for it. So um definitely very eye-opening, and you know, definitely something that you know, after going through that, I started taking my health very seriously. After I received the surgery that I needed to remove the tumor, I started undergoing chemotherapy. And about maybe a month or a month and a half after my initial diagnosis, and it ended up being stage 3 colon cancer. So it had spread to a couple of my lymph nodes outside of my colon region. And I started chemotherapy and completed 6 months of chemotherapy, a total of 12 cycles. And uh, thank the Lord above. To this day, I am cancer free, and happy to say that you know, everything appears to be on the up and up. And you know, I really just, you know, I'm so glad that I took that initiative and trusted that like something wasn't right, and felt like my body was trying to give me a signal on, you know, that something wasn't okay, and just proactively going in and getting that initial, you know, treatment that I received, and then them finding the tumor. But um, that was kind of like my experience, just going through, you know, that diagnosis and having the surgery and going through chemo. You know, that was kind of like the process of what I went through. And along that way, I was able to discover the Gathering Place. So it's been a great like foundation. I discovered the Gathering Place when I was going through my chemo classes, and I wanted to go check it out. I heard they had a beautiful garden, so I was interested in seeing the garden that everyone was talking about. And you know, upon entering the Gathering Place, I was greeted with open arms, and um, you know, just started to dive into some of the programs that they offered during my treatment. And one of the biggest things that I really enjoyed was just being able to connect with other people that were going through what I was going through. And the Gathering Place really helped with that, and was just instrumental to my journey throughout my cancer battle. Um, I took advantage of some of the many programs that they offered. So, Casey, I didn't know if you wanted me to kind of expand on that at that point, or.
Yeah, I think that would be helpful, Vincent. What programs kind of supported your survival journey?
Well, the first one I really got into was the young adults surviving cancer program. That was the first program that I attended. And um, by the Gathering Place providing that type of program, it was able to allow me to connect with people around my age who were going through the same thing that I was going through. You know, and really feel like that I wasn't alone in my battle, because that's one of the initial things that you start to feel when you receive a cancer diagnosis is, you know, there's a lot of people that are, you know, reaching out to you and providing support, you know, but not often is someone around your age going through the same thing that you're going through, or anyone in general. And it could be very it could feel like a very isolated experience. So I was able to meet once a month with our young adults program at the Gathering Place, and I still attend that program to this day. And it's just great to be able to connect with other people and help it feel like it's not like so much of you know, a journey on your own, and just to know that someone else is going through the same thing that you're going through around your same age range. The other programs I also took advantage of were the exercise programs at the Gathering Place. Uh, that's right across from their Beechwood location, which is the location that I attended, and allowed me to kind of help with my fatigue throughout my chemotherapy treatments. Often days I would feel tired, and you know, kind of the fatigue would start to set in. And by you know, practicing and exercising with these programs every other day or so, really helped kind of with kicking that chemo fatigue, and helping me stay active and to, also lose some weight too in the process of going through chemotherapy, and being a little bit more healthier. Some of the other programs I took part in were cooking classes that were provided by Beth at the gathering place. So Beth is very great with nutritional information and helping find, different foods that help prevent cancer, and just healthier options and alternatives that you wouldn't even think of. And just really helps, explain, different recipes and things that you can make that are healthier alternatives to, some of your other food options to change that diet after a cancer diagnosis. And one of the other programs I also attended was guided meditation. And I felt like that the guided meditation courses were extremely helpful. It helped me relax, and I took advantage of using the library too as well to rent out guided meditation CDs that actually helped me, kind of like disconnect and kind of like escape on days where I felt like I was experiencing high amounts of anxiety from just like multiple doctor visits or, chemo treatments. So anything that really, can, help you relax, while going through a diagnosis or treatment, was provided for the gathering place. And I thought that guided meditation was instrumental as well. And I still use guided meditation to this day to help me relax. And, just with everyday life problems. So it introduced me to, a large group of people, and kind of helped expand my, just like my mindset and my thoughts, and how to deal with going through this this diagnosis that nobody ever really expects.
Oh, that's so helpful, Vincent. Thank you. I think I even remember you checking out the Zumba classes.
Oh, yes, I forgot as well. Yes, the Zumba classes were also very good. Very, positive. It helps get you moving, and when you exercise to music, I feel like it's easier to exercise. So Anita did a really great job of that Monday motivation with the Zumba classes, and kind of helping you start the week off on a good note. And yeah, I've tried to take advantage of as many opportunities and as many events that the gathering place has offered, over the years. And
Yeah.
I've also, at that, before COVID, we had the opportunity to attend massage therapy and then reflexology as well. So it definitely broadened my horizons, and introduced me to new ways to help deal and cope with everyday life issues, as well as a cancer diagnosis, by just simply walking into the gathering place and figuring out what it was all about.
Yeah. Vincent, thank you so much. I think you did a good job highlighting all of the free programs to really help people kind of move forward in their survival journey, and manage all of the side effects related to the medical treatment. We don't do any medical treatment at the gathering place, but we are trying our best to provide things to help people manage the stress related. There's a lot of research, and Aqeel might even be able to talk about this, related to managing stress in order to manage side effects better, in order to manage cancer better, and to move forward. So this is helpful. But Vincent, I think we want to keep you on for any Q&A, but Aqeel, maybe we
Sure.
can talk a little bit about other resources. Vincent, I think I need you to mute this part.
Okay.
There we go. Okay, great. So Aqeel, let's talk a little bit about resources available to Clevelanders. And so we have found with quarantine that we're seeing people on the screen from all over the country who are able to access all of our virtual programs. And I think that's true for the medical community also.
Yeah, absolutely. Excuse me. One of the things I like to highlight from, I guess, a northeastern Ohio perspective is what we offer at the Taussig Cancer Center is a program called Patient Navigation. And what that is, it's a program designed really to connect one-on-one with, potential patients. These are patients who do not have a diagnosis currently, but are in need of a screening and have particular barriers kind of prohibiting them from actually completing that screening. So whether it be transportation, loss of insurance, lack of access, prep assistance with their prep. Patient navigators really connect with the patient one-on-one. We'll walk them through step by step, all the way from at the actual pickup from your home, all the way until the completion of your appointment. So that's a service that we have seen tremendous success in our screening rates, and also just connecting with the general public and raising awareness around just different screening guidelines. What could be breaking news in terms of incidence rates, diagnosis rates, for particular geographic locations throughout the city of Cleveland. Our patient navigation footprint now reaches all the way down to Lorraine and also Mansfield. So, just about every location that there's a Cleveland clinic, we have patient navigation access. So if there's anyone, who's viewing this live, who needs assistance, or needs assistance getting screened, and whether it's, I know we're having a discussion around colorectal cancer, but, for any, whether it's mammography, whether it's PSA screenings for prostate exam, lung screenings, our patient navigators are well versed and know how to connect you to a facility that's just best suited for your needs. You don't always have to come to the larger hospital, but if there's a community hospital that services those same needs, our patient navigators can connect you with them as well.
That's so helpful, Aqeel. I don't know why I'm getting feedback here, but we do have Cleveland Clinic sites all over the, in different states and countries as well. And I'm really pleased that you mentioned all types of cancer screenings, because
Absolutely.
As Dr. Kyei talked about, there are so many familial cancers that could be connected to colorectal cancer, that's really helpful. But in general, we have many people watching today that have a history or might be on the journey with other cancers. So that's great. So we do have a question about how to contact the navigation line. So I think that we will put that up under, that'll be one of our little banners going across shortly. But Aqeel, if you can here it is, the patient navigation line, 216-444-7505. So thanks for that question. That's great. So keep the questions coming about any part of colorectal cancer or any cancer-related kind of things that any of the three of us could answer, or in your comments are very appreciated as well. We do have a question for Vincent. Vincent, how long did you experience the abdominal pain before seeking medical attention?
Yes, very, very good question. So I started to experience like very mild, like almost like stomach ache pains about maybe like a month before. But what really prompted me was one specific weekend, I started getting like very severe abdominal pain, kind of almost out of nowhere. And it was to the point where I was constipated as well. So that was like really what prompted me, was because I wasn't able to go to the bathroom, and I mean, it was excruciating. It was to the point where I was not even able to sleep anymore. And it went away for like a day or two because I thought I was maybe just sick and I was, just eating lighter. But then once I returned to like my regular eating habits, it kind of came back in like that few days later. And that's when I really was just kind of feeling like something wasn't really right. And I went in a few days after first experiencing like that very severe abdominal pain to the point where I couldn't sleep. But about a month before that, I was experiencing like very mild stomach cramps every other few days or so. So really nothing too alarming, but that was really the only sign that I had. The other thing that kind of popped up was I had my doctor thought I had an iron deficiency. So started supplying me on iron supplements because, with someone with no family history of colon cancer, wasn't really something that they were looking for. So I started taking iron supplements about maybe like a month or two before I was diagnosed. But what I found out was that my low iron levels was likely due to my internal bleeding from the tumor. So that's one of the other signs that I really didn't know of at the time, but now I'm aware of it. That can be a very alarming sign of like a iron deficiency or a low iron level in a young adult.
So, Vincent, thank you. I think that was helpful information, because to think that a month earlier you had mild stomach aches, and that really speaks to the need for people of all ages, but particularly younger people who aren't typically needing to think about and kind of track any kind of symptoms, that we have to keep, kind of track of different changes in our bodies for all ages, and to maybe make note of those, because sometimes you might forget, has it been a week or is it 2 weeks? Or, where are we at with this? I think that was really helpful to realize that your symptoms started off very mild and then grew over time until you were in excruciating pain. And I think the other point that you noted is, internal bleeding isn't always noted on the outside. That sometimes that's also a symptom that goes undiagnosed, and creates an iron deficiency. So, when your doctor suggests different tests, you want to jump on that. And we're seeing lots of tests even on commercials today related to colorectal cancer and those mild screenings. So there's a question about, is there a trend of younger individuals getting colon cancer? And Aqeel, do you want to jump on that? I can address that too, but.
Yeah, absolutely. And as you know, if you missed Dr. Che's wonderful presentation, he touched on the upward trend of diagnosis in younger adults, meaning the population that's under the age of 50, which is considered the screen eligible age. And I believe since 1995, it's been a 50% increase in younger individuals being diagnosed with colon cancer, with an annual average increase of 2%. So, there's right now not a definitive reason why that is, but, a lot of studies attributed to the things that we can control, which is diet and exercise. Obviously, now those things are probably occurring a lot less than they should. And so that could kind of attribute to such an increase. But again, it is not definitive.
So other telltale signs are smoking, which we usually think in terms of lung cancer, but smoking over a period of time actually has a direct correlation with colorectal cancer, as well as bladder cancer and different things. Heavy alcohol consumption as well is another risk factor. But there are certain other things in terms of how much weight we carry on our frames. Weight is a direct association as well. But I'm glad you touched on the diet piece, Aqeel, because they're really looking at all of those microbiome things that kind of hang out in the colon, and those that are not healthy, and those that are directly related to colon cancer. And so that's why there's so much emphasis on plant-based diets, high in fiber. So people with low fiber diets, not a good thing. You want to go with the high fiber. So, but Aqeel, this is so helpful.
Yeah, I want to ask Vincent as well, after, how has your diet changed before and after, but also, now that you mentioned, Casey, that obesity is now the #1 determinant factor for a lot of other comorbidities. So if you are obese, you have a higher risk of high blood pressure, cholesterol, diabetes, coronary artery disease, heart disease, and also cancer risk. So a lot of that is based off of, our diets, our high fat diets or high sugar diets, high salt or high sodium intake. All of that, becomes a contributory factor whether, we suffer from some of these illnesses or diseases. So I wanted to ask Vincent, if you want to disclose, how was your diet prior to being diagnosed, and how has your diet changed moving forward?
Yeah, absolutely. I'll be happy to share that. So, one of the big main things that I've done with my diet is cutting out or limiting red meat as much as possible. And one of the other things that I've done is switching to organic based foods as much as possible as well. Um, there's been studies over the years that have shown that red meat and non-organic like chicken can contribute to possible like colon cancer diagnoses. And I wasn't really eating the best, prior to my diagnosis.
Mhm.
Another thing that I've done is incorporated more fruits and vegetables into my daily diet. I make smoothies almost every day with fruits and vegetables. And that's something that I learned through one of the cooking classes at the Gathering Place was really how to make a good smoothie and, just being more mindful of like what I put into my body. Looking at like nutritional facts, making sure that, um, items that I'm consuming are low in sugar. Cutting out, any sodas or, switching more to drinking water and, um, you know, just really like being more mindful of, what you put into your body before, you just grab like a bag of chips or, whatever and,
Mhm.
just start eating. But yeah, like it's those are some of the things that I've done is cutting out red meat and or just like limiting it like to very like maybe special occasions. And then just also limiting like any like foods high in sugar like bakery, donuts, things like that. Like I don't keep that in my apartment. So those are some of the things like cutting out soda as well, because a lot of the additional and fake sugar can also contribute to a cancer diagnosis too, and can produce cancer. So those are some of the changes that I've made as far as like in my personal diet and just incorporating more fruits and vegetables as well, and trying to exercise at least maybe like 45 minutes to an hour, 4 to 5 days a week, because regular exercise can also help reduce your cancer risk and just staying active for
Absolutely.
that period of time.
Absolutely. Thank you, Vincent. I definitely think obviously you're on the right road and right track. And so just for, an action item for all of us viewers and all of us online, to be proactive, be very proactive. You have an opportunity to change your diet, control your diet, be more intentional in what we put in our bodies, as Vincent just stated. I think it's for us younger individuals or people that fall into that population. It's really time to be proactive and not reactive, and wake up and soak in this information and knowledge that was shared, but not just retain it, but you actually have to follow through and do something. So if you don't have a primary care doctor, find one. If you have loved ones who are suffering from things, connect them to the tons of resources at the Gathering Place that Vincent kind of just walked through. So there are resources out there. There are things that you can do today to lower your risk for whatever cancer or whatever comorbid disease. Again, it is time for the population to really be proactive and not reactive.
Thank you, Aqeel. That was so great. I think it was a great question that helped us learn more the before and after of Vincent, because to be diagnosed with a stage 3 cancer, such as colon cancer, which is ever so serious, and Vincent, the way you really took the horse by the reins and changed your lifestyles and continue to practice, a couple years later, everything that you learned. And so those are all pearls of wisdom for the rest of us.
Mm-hmm.
So thank you.
Yeah. I'd like to take my hat off to Vincent as well, because working in the community, you hear so much. I've been experiencing this symptom for 2 years, 3 years, 4 years, and they continue to just absorb that pain and put it on the back burner. And, they do end up with, very late stage, diagnosis when they finally do seek help. So, I definitely want to, give you credit for, being active, making sure that you, listen to your body, and took the right steps, in the right place, and, take good care of yourself. Because again, it is such a detriment when we can just overlook, what our body is telling us. And so oftentimes it does not end well. So I'm glad in your case that it ended very well, and continue to go on your journey.
That's
Yeah,
great.
absolutely. Thank you. I appreciate it. And, that's the biggest advice I can give is be your own health advocate. Nobody's going to care more about your health than you, and to just trust your body. If something doesn't seem right, reach out, find a primary care doctor, have some blood work run. Blood work can tell a lot about what's going on in your body. So just the simple, annual blood test that a doctor would provide would be able to tell a lot about what's going on inside.
Thank you, Vincent. And also, again, just another shout out to the Cleveland Clinic patient navigators who can really help people even, get the insurance that they need and get the tests that they need and get pointed in the right direction. I want to thank everyone for joining us on our first Facebook Live event on colorectal cancer in young adults. Please let us know in the comments section what's been helpful. Are you walking away with a little pearl of wisdom yourself? But if you or someone you know is currently coping with cancer and can benefit from the free services at the Gathering Place, please visit the Gathering Place at touchbycancer.org or call 216-595-9546. Dr. Kyei, Vincent, Aqeel, thank you so much. And I think that this was so successful. I think we'll have to do another round at some point. This was great. Aqeel, you are just so marvelous to work with and to partner with the Gathering Place. We can't thank you enough. And Vincent, you're a true ambassador, and thank you for educating so many people, not just through today's program, but the many education programs that you've helped us lead. Thank you. Have a good afternoon,
No
everyone.
problem. Bye, everyone.